talk about the respiratory system. Yet again, as I always mention, it's one of the 11 body systems in our body system, or in other words, organ systems to help us stay functioning and alive. All right, so the learning objectives, talking about the anatomical structures and positioning, body cavities, and the principles of pneumonia. So again, respiratory system, of course, just a part of breathing, inhalation and exhalation, or inhaling or exhaling. Okay, so this just talks about some of the major cavities. Cavities just kind of simply means just like a hole. All right. So basically right here, as you see here, the lungs are part of the thoracic cavity. So this is the thoracic cavity. All right. And that's where the lungs are. So it's kind of showing it right here, this area in purple. All right. Actually, I'm sorry, this whole area, thoracic cavity. The thoracic cavity is just right before, underneath the throat. So it's inferior to the throat, but superior to the diaphragm. All right. So this part is known as the diaphragm, helps in breathing. All right. So it's part of the thoracic cavity. All right. Of course, we have the abdominal cavity. This is the abdominal cavity, the pelvic cavity, the cranial cavity, okay, the vertebral cavity for the vertebrate. So those are basically like the 5 main cavities. But the main thing which I really want you to know is, yeah, basically where the lungs, that's a part of the respiratory system, which cavity you can find them in. That's the thoracic cavity. And again, also know that the thoracic cavity right here and the abdominal cavity right here are separated by the diaphragm. So here's the diaphragm right here. All right, and the diaphragm is going to play a role in breathing. Well, pretty much just in the breathing process itself. Okay. All right, this is just simply a cross section of from a cadaver, and again, thoracic cavity, right? You have the diaphragm here, all right? And inferior to the thoracic cavity, you have the liver and the intestinal organs, the stomach, so on and so forth. And then superior to the diaphragm, you have the lungs and the heart, so on and so forth. So again, this line kind of showing so above, superior, thoracic, below, abdominal, and it's separated by the diaphragm. Yeah, just another picture here. Diaphragm, thoracic up here. We'll get into some of these other things here in a little bit. You have the trachea. That's basically where the air is going to be moving down into the lungs to supply air to the lungs. All right, that's just a picture of the lungs. Thought it was kind of interesting, but yeah, that's actually what the lungs actually look like. They're pretty big. So of course it plays a role in the breathing process, the main role in the breathing process. All right, so just some of the anatomical features here. Okay, so you have the trachea. The trachea, all right, so here's the mouth, and then the trachea actually is like the windpipe, the tube that's going to actually take air into the lungs, and then when we exhale, the air is going to go through the trachea going out. All right. So inhaling, air is going in through the lungs, and it's going to fill the diaphragm. I'm sorry, not diaphragm, the lungs. Here's the diaphragm actually here, right here, the diaphragm. All right, and then it's going to go out. You see kind of like these ribs, that's cartilage from the trachea. All right, the alveoli, right here, if you kind of just blow up the picture here, that's going to be, and I'll talk a little bit more about this here as time goes on, but right here, and this is where blood gas exchange actually occurs. Because of course, when we breathe in, we're breathing in mainly oxygen, and we want the oxygen to go throughout the body. So as the circulatory system is coming by, here with the alveoli, not the bronchus or the trachea, but right here, it's going to dump the oxygen, okay? You write oxygen, O2, diatomic molecule, all right, into the circulatory system. Circulatory system is going to dump off CO2, all right, to the alveoli. All right, so again, that's where blood gas occurs here. All right, so again, it allows for gaseous exchange, oxygen and carbon dioxide here at the alveoli. All right. Oh, again, and well, I'll talk about the bronchus here. I think that there's not, I think, but there's some other pictures that'll show it pretty well. All right, so just as far as the breathing process is concerned, again, air going in through the trachea, and what happens is that the rib cage is going to expand. Why? Because again, we're taking in air, and rib cage, I'm sorry, the lungs rather, not the rib cage, but the lungs is going to expand, and actually the rib cage is going to push up a little bit, and then and the diaphragm is going to go downward to allow the lungs to expand to bring in more air, and then when you exhale, all right, and then of course the lungs are going to deflate a little bit, of course not fully deflate, but when you exhale, deflate because you're breathing air out, all right, and then the diaphragm conversely actually that part relaxes and it moves up. So when you're inhaling, the diaphragm contracts, moves down. When you're exhaling, the diaphragm relaxes and moves up. All right, again, pretty much the same thing that I just talked about. Going through the trachea, air into the lungs, diaphragm is going down to give the lungs more room to bring in some air. And then when you're exhaling, breathing out. And when I'm saying air intentionally because yeah, it's oxygen of course, but we're also breathing other things like nitrogen, carbon dioxide, just small amounts there. But so air is composed of a number of gases. Actually, air that we breathe in actually is really only about 21% oxygen. Okay, sorry, so messy. They're kind of hard to write. Yet again, inhalation. The lungs expand. All right, ribs move up and out to actually give your lungs a little bit more area to expand. Diaphragm actually curves down. All right, and then exhaling, then the diaphragm pushes up, and then of course the lungs deflate. All right, some anatomical features. Yet again, like I said, the trachea cartilage right here. All right, and it's going to the bronchi. Bronchi is plural. Bronchi is plural. So we say bronchus, like here, like the left bronchus. All right, and we can talk about the right bronchus. All right, so bronchus is singular. Right bronchus, just right here. That's one bronchus. The left bronchus, that's singular. But as you see these lines here, pointing to more than one, the bronchi, that's plural. Yet again, the diaphragm here. All right. I think we talked about the naropharynx and the oropharynx before. But I want just more so and this is more so upper respiratory. I want to get into like around the trachea on down. All right. So again, like I said, bronchus singular, bronchi plural. What is it? Any major air passage of the lungs which diverge from the windpipe. So again, trachea. All right. And then you have the primary bronchus, secondary bronchus. So you get the primary bronchus, secondary bronchus, tertiary, which means kind of third, tertiary bronchus. And then you get into the bronchioli. And the difference is that bronchioli is actually going to be smaller and does not have cartilage. All right. So the bronchus, actually a little wider in diameter, has cartilage, but the bronchioli does not have cartilage. Small in diameter, and then gets into the alveoli where you have the blood gas exchange. Okay, so again, this will be the left bronchus. All right, if you're looking at the patient or anything, and then this will be, of course, going towards the right bronchus area into the bronchioli and the alveoli. Just another picture again, trachea, cartilage. Again, the left bronchus, secondary, tertiary, bronchioli. Again, like I said, the difference, a little smaller diameter, kind of towards the final end of the respiratory system in terms of going towards the final end down to the alveoli sac. All right. So this area again is simply just kind of conducting. All right, bringing air in, but remember also air is going to go out as well. Okay, it's going to go out as well. And respiratory, that's where the respiration part is going to happen and of course like blood gas exchange. So it, of course, the whole thing plays a role in the whole respiratory process there, but this is conducting air coming in and flowing out. And then right here again, like I said, where the alveolar sacs, alveoli, blood gas exchange.